Dr. Wood, you're an orthodontist, and you're straightening out teeth with braces. And while I can see that this is a very, very good thing, that one doesn't need to pull teeth and put veneers and do all kinds of things with teeth in a surgical way, isn't there also the problem of, I remember when I went to school and, you know, people who had braces, and even today still I see people running around and they're a little bit, yes, it's more fashionable than it ever was, but still people have, kids and adults have a problem with the looks. How can they justify taking braces when then for a couple of years they don't look so good?
Well, some people do have a problem with that. It kind of depends on the age. Nowadays, a lot of the younger teenagers tend to enjoy having braces because of all the colors they can put on them, and that's very popular. But the older teenagers and adults usually don't want the hardware on their teeth. And now, as of the last 10 to 15 years, we've been using Invisalign, and that's been a big improvement for a lot of older patients. I have Invisalign patients from the age of 12 all the way up into the 70s. So we do a lot of adults, older patients, retired patients, and it's very much easier with the Invisalign because they're not that noticeable, and they're fairly invisible, and they're actually more comfortable. And for a long time it was more expensive, but now it's about the same cost-wise as braces.
I see. So a person can get those Invisalign, which is a little bit like a mouth guard, and it gets put on and it straightens out the teeth. I'm sure we're going to go into that, how that actually works a little bit more. But now let me ask you, so what you're saying is that they really are relatively basically invisible. So if I am a business person, if I would be talking to you now the way I do talk to you now, and we are talking on a video, so this is obviously, we see much less, would you notice it if I would have Invisalign on it? Not because you know it as a dentist, you guys notice all kinds of things, but as a normal person, would he notice it, yes or no?
No, you really can't see them. I used to do consultations with patients while I was wearing Invisalign, and I would stop and point them out, and the patient hadn't noticed them. So they are very much invisible, and you can talk normally, and it doesn't interfere with your lips as far as the irritation, and they really are just practically invisible.
Wow. So that's a big thing, and even the price is kind of like the same. What about the treatment length? Longer, shorter, same? What are we talking about?
Yeah, that's a good point. A lot of patients ask that. They want to know about the price, and I can tell them the price now is about the same. But also the treatment time is about the same, and also the results nowadays are comparable. We get very good results with Invisalign, just the same as we do with braces.
Well, right. That was very enlightening, Dr. Wood. Thank you very much.